didn't finish this chapter. Okay, we're having a test on this chapter on Monday. So we're going to try to go ahead and get through this chapter so we can won't get behind. I'm not really interested in the bones because you've already learned all of that in anatomy and physiology in college. The only things that's important for us is the symphysis pubis, the sacrum, and the coccyx. All of those are they're important for us as sonographers. The sacrum and the coccyx, because we do baby spines, looking for tethered cords. Not so much in the adults because the bone is so ossified that we're not able to see anything pertaining to the bone. So you have 5 sacrums and you have 4 coccyx. Now the coccyx muscles are attached to the symphysis pubis. The symphysis pubis is the front bone of our pelvis, okay? So the coccygeus forms a hammock in the pelvis, so that way it holds our internal organs along with the levator ani. The levator ani are a group of 3 different muscles. Now you've got the true pelvis and you've got the false pelvis. The true pelvis holds all of your female parts. The false pelvis, as far as we are concerned, is just bone and muscle. Okay? Of course, you've got your rectum and things like that that will be in the false pelvis. The false pelvis, I need for you to know what's in the true pelvis. The obturator, so there was some confusion. I had a little discussion with Dewey this morning that he was having a hard time picturing the muscles. Okay, so in the false pelvis, you've got the iliacus and the iliac fossa. This is my false pelvis. These big bones up here are part of my false pelvis. Okay. My true pelvis is separated by the iliopectineal line, or what's the other name? Vena terminalis. Okay, it's got named by 2 different names. Okay, so the obturator internus muscles, they are the ones that protect, that are attached to the bones in my pelvis. Okay, oops. Okay, the piriformis. The piriformis is my posterior pelvis. This is my posterior pelvis. Okay? My coccygeus and my levator ani. They connect my coccyx to my symphysis pubis, and it's a hammock between the 2. Okay? It just connects the front pelvis to the back pelvis, like a cotex.
Cotex.
That's the coccygeus?
Yeah,
coccygeus. Okay, those are the ones that you're going to have to know about inside of the registry. Okay, so the levator ani muscles, there's 3 muscles that make up that hammock or the pelvic diaphragm, and they are the pubococcygeus, the puborectalis, and the iliococcygeus. Those are the 3 that make up the levator ani muscles. So here is a picture of an ovary. Here's a picture of an iliac artery or vein. If we cannot find the ovaries, we go laterally and pick up those vessels, so that way we can hopefully find the ovaries against them. This is the psoas major and the iliac muscles. We know a muscle because they are striated. They are striated. That's how we know a muscle. Now the piriformis muscle is the muscle that is most commonly confused for an ovary. If you're not sure, because an ovary usually has a follicle on it. But if you see something that is symmetrical to the other side, more than likely it's a muscle. Okay? Turn on it. If it's striated, it's a muscle. If it's not striated, it's your ovary. Okay? So, this is transabdominal. This is transvaginal. Okay? So, I am transverse. So, this is anterior, posterior, medial, lateral, or left, right. Okay? Because I'm in the middle, this is medial ovary, this is lateral ovary. This is a transabdominal image. Anterior, posterior, left, right. Anterior uterus, posterior uterus. Left uterus, right uterus. This here is a urinary bladder. A urinary bladder should always be anechoic. We use it as a cystic reference for other anatomy inside the abdomen. Okay? And this muscle here is the iliopsoas muscle. So here you can see that you have the coccygeus. Here you have your symphysis pubis. So here is my levator ani muscles. They form a hammock from here to here along with the coccygeus muscle. The coccygeus and the levator ani muscles are the pelvic floor. Anterior, posterior, left, right, transabdominal. Okay, here's my cervix. This is a muscle. Here's a muscle. See how it is striated? Okay, so this is the, what is that muscle is that?
Mass.
Iliopsoas muscle. Iliopsoas muscle.
No, it says
Mass adjacent to cervix.
Oh, a mass adjacent to the cervix. Okay.
Yeah.
So, because here's my cervix, and here is the mass in the left adnexa. Okay, because it's next to. Okay. Transabdominal, anterior, posterior, left, and right.
the next on the lateral.
Next to. Adnexa, that's all it means, next to.
Yeah.
Okay, so I have my ovaries are next to, they're in the adnexa. And here's just a picture of how the pelvic floor, here's the levator ani muscles and the coccygeus, and they form from the coccyx to the symphysis pubis in the middle. And then the piriformis muscle is here. It's the lateral side walls, the posterior lateral. Remember, it's these muscles back here, okay? They are the ones that are most commonly confused for an ovary. Turn on it, if it's striated, it's a muscle, okay? And here it's just showing again the coccyx to the symphysis pubis, and how you have a hammock between the coccygeus and the levator ani muscles. Those are the main muscles that I need for you to know. Okay, the pelvic organs, you've got the true pelvis and you've got the false pelvis. The false pelvis is also called the greater pelvis. The true pelvis is called the lesser pelvis. It is separated by an invisible line, the iliopectineal line or the linea terminalis.
So they can be both, one of the
Either or. I have to teach you both because I don't know which one the ARDMS is going to ask you. And this is just a picture of the iliopectineal line. Okay? All of this is true pelvis, all of this is false pelvis. How many sacrums do we have?
5.
5. Okay. This is, I put this up here so you would know because this is the Labia Majora is the one that the round ligament that holds the uterus in the forward position inserts into the Labia Majora. Some places you will have to catheterize your own patients. It's right below the clitoris, inside the labia minoris. You've got the mons pubis, the labia majora, and the labia minora. This area here is called the perineum. Perineum. Okay, we're going to talk about the vessels. I mean, the spaces that we have to look for free fluid, starting anterior to posterior. Anterior, posterior. I've got the space of Ritzis, also called retropubic, also called prevesical. It's behind the pubic bone. It's in front of the bladder. The anterior cul-de-sac, it's also called the vesicouterine because it's between the bladder and the uterus. The posterior cul-de-sac, it's between the rectum and the uterus. It's called the rectouterine or the pouch of Douglas. It's the pouch of Douglas where we're going to see most of our free fluid inside when we do a pelvic exam.
I have a question.
Yes.
The complex area, I usually see when they do the uterus, pelvic exam, they always check that area.
Always.
Yeah, for
Free fluid.
Oh, okay.
Yeah, we always check it for free fluid because we should not have any free fluid in our pelvis. A lot of times during middle schmerz will cause a little bit of free fluid. What is middle schmerz?
It's during
It's pain associated with ovulation. Okay? So, anterior to posterior. Here's my pubic bone. Here's my bladder, anterior to my bladder. Space of Ritzis, retropubic, prevesical. Between my bladder and my uterus, anterior cul-de-sac, vesicouterine. Behind my bladder, in front of the rectum, posterior cul-de-sac, rectouterine, or pouch of Douglas.
So can you point which one is the posterior cul-de-sac?
You tell me. Where's this arrow pointing to?
So
Between
is that-
between the uterus and between the rectum.
And this one here, the anterior is
Anterior.
this little line.
It's in on top of the uterus, behind the bladder. Okay? This is not exact, it's just me. Okay? It's just so you know where to look in those spaces. Okay. This is where the ureters enter into the bladder. The ureters enter into the bladder, posterior, inferior bladder. Okay? Here's my bladder. Here's my bladder. Posterior, inferior is where they insert into the bladder. That area is called the trigon. The trigon also is where the urethra will open up to go into the toilet. Okay? So the trigon, this area right here, is where the ureters enter in inferior, posterior bladder, and the urethra comes out of the bladder. That's called the trigon. Posterior, inferior. The bladder. You've got the apex, the base, the neck, and the trigon. Apex. Let me see. I got myself confused. The trigon, the neck, the base, the apex. Yes.
So the spaces that can contain the fluid, we're looking at this in regards to like the uterus, like what is it having an effect?
That's just fluid in my peritoneum. Why do I have fluid in my peritoneum? Usually pathology. Okay? So it's our job as sonographers that we annotate and we document any free fluid, whether it's a sliver or whether that's all I see. We have to put FF for free fluid because there should not be any free fluid. But a lot of times during ovulation or middle schmerz time, then a lot of times we'll have posterior fluid.